talk about hair loss and restoration of hair. Dr. Glynis Ablon and Marianne Senna will be coming up, and I think Dr. Ablon is starting, correct?
Welcome back to South Beach. I'm excited to be here after landing from Paris on Sunday, so it's a little crazy. Dr. Sen and I are going to try to make this a little bit more interactive, so we'll each give a talk. If you can set the timer for 10 for each of us, and then we want to do a good Q&A. I have questions for her, she has questions for me. If anyone would like to do a hair loss consult with us on stage, we are willing to do that. We decided and we thought we would offer it out there. I don't know if anyone wants to be a big, brave person and have any questions, but we are happy to do that. If you would like to, please just come up to the corner and let us know that you are interested. Otherwise, we will just do questions and answers ourselves. Okay? So these are my disclosures. I do a lot of research in hair. I currently have 2 exosome studies starting very soon, and I have 3 hair loss supplement studies that are going on right now. But hair loss is a big deal, and it's not just in the United States, of course, it's all over the world. And I know COVID, for many of us, had us getting a lot more patients in our office complaining of hair loss or noticing hair loss from the stress of COVID, not just the illness itself, but just the stress of living in a pandemic time. And this is a big issue, and I think that we need to address it. I address it with every one of my patients. So if I'm doing a full body check, I do medical dermatology as well, and if I'm doing a full skin exam, it is something that I discuss as well. But hair can be a big deal. This was my mother, and when my mother was, when I was 2, my mother decided she wanted to rip through my hair, and I wouldn't let her, so she cut it all off. But you can see her hairdo is a big deal. Many people are fine with their hair loss. So there are many men that come in my office, and they're losing their hair, and it's not a big deal. But for women, it can be a much bigger deal. And we know that there's a much bigger psychological aspect. Bald men can walk around, and oftentimes it's no big deal. But a bald woman, oftentimes individuals will think, oh, do they have cancer or something else going on? So I think that this was a really interesting study. It was an independent study of 2,000 women. And I was surprised by some of the information in here. When they talked about 39% of women thought that they weren't interested in sex when they had a bad hair day. These numbers were fascinating to me, but obviously the takeaway is that it can affect individuals significantly, and many women envy women with beautiful hair, and so it's something that we want to be able to address. So remember that the etiology of hair loss is multifactorial. It's important, and I explain it to my patients all the time, that no matter what hair loss we're dealing with, there are other issues that play a part, and that includes the hormones, the stage of life that people are in. It includes nutrition. I always say you are what you eat, so what you're putting in your body will reflect not only your hair, your body, other symptoms, other medical conditions that you have. We also have lifestyle and environmental factors and pollution and all these other wonderful things that are going on around us that we need to keep in mind in addition to the genetic component of hair loss. And then we also have different kinds of triggering factors. We know that there's inflammaging, which was a term that was coined about 4 years ago from a dermatologist from Italy. And so we see this chronic inflammation, it becomes this cycle, and we really do throw the hair into this non-growth pattern, and we disrupt the normal signaling. So what we're trying to do is figure out how do we address all of these issues when it comes to hair loss, including stress, because I think stress affects so many parts of our lifestyle, including this increase in cortisol, which tends to lead all of our negative energy into our body, and it can do a lot of damage, including hair loss. So we really want to address all of these factors, talk about the hair growth pathways, and understand that there are many ways that we can address or attack hair loss. There are 487 active studies that are going on as of January of this year alone. So people are looking for more treatment options. There are many other things that are in the works, in the pipeline. So I'm going to go through a summary of just certain ones that are available that we know now. This is just my summary slide to show kind of how I approach a patient. I have a lot of different things that we do. I do think there's a step-by-step way to look at this, and I do have slides on that as well if anyone wants to see them. And I do give questionnaires. Dr. Sen and I were talking about this. I do give questionnaires when people come in, describing hair loss to get kind of a history of what's going on with their lifestyle and all that. I talk about all the things here that I will add on, and again, depending on what type of hair loss they have, I think it is important to diagnose the hair loss And then, of course, make sure you discuss all the treatment options. So what are our treatment options? We have oral medications that are available, and Dr. Senna will go into more detail about these oral medications. But we have oral medications that we can prescribe, knowing how they work. Sometimes we don't always know exactly how they work, but knowing how they work and what the side effects are very important. We have topical agents that are available both over the counter. You can have certain ones compounded. We do sell out of our office, our prescribe out of our office, a compounded phenoxidil, which is finasteride, minoxidil, and retinoic acid, but you can also get a compounded version with dutasteride, minoxidil, and retinoic acid as well that patients can use. You've got spironolactone, and again, Dr. Senna will go over in detail about these. You've got flutamide and bicalutamide, and again, understanding how they work, understanding side effects, making sure that you go over all these treatment options with your patients, including the cost-benefit profile, how well they work. You know, there's a lot of data out there. I did a summary article with Dr. Nestor and his team a couple years ago, talking about all the data, and you can see on here, the efficacy may be good, but the question is, what kind of evidence do we have? What kind of clinical trials are out there and published? Nutraceuticals, you know, this is something I'm a big fan of nutrition. I think you are what you eat, and I think it's very important. Whatever you put in your body will really be reflected in everything on your body and how your systems work, GI, brain, everything. And so we know we have that brain-gut combination and how that relates to what we're putting in our body. Nutraceuticals, to me, I don't say it's the end-all, be-all, but I think it is a nice addition to what we can offer our patients. If everyone had a absolutely perfect diet, maybe they wouldn't need a supplement, but I don't think everyone has a perfect diet. Anyone have a perfect diet? Absolutely perfect diet? Any hands? No. Okay. Me included. So you've got the standardized botanical ones, you've got the deep sea fish protein ones, and again, we've done studies on all these. I think the more data we have, the better we are, but they do work. They are, again, not standalones. Just to show you some pictures, these are actually from, one's from my office and the other one is from Dr. Burgess's office, but you can see that these are patients, and in these studies, these are just patients only on the supplement alone for hair loss. Complementary and alternative medicine, that is a big category, and the supplements kind of fall under that, but a large part of the population really do want these alternative therapies. They don't necessarily want to be on prescription drugs. They want to know what else they can do naturally without prescription, and so low-level lasers, before my mother passed away, this is my mother sitting under her laser at the office. She loved it. She came in every week without fail. And again, the evidence for using low-level lasers is strong, as well as the efficacy. So you can do lasers, you can do light-emitting diodes. This is my father. He passed away last year, and he loved his little home cap that he could use. Of course, would always forget to unplug it once it was charged. But again, the LED works as well. Here's a patient of mine after laser hair growth, and here's a patient of mine also after laser hair growth, and this is just to show you after LED therapy. Complementary devices, again, we've got microneedling, something you can add. Typically when we're doing microneedling, we'll use a product at the same time. You've got PRP that can be done with good results. Growth factors found there. Here's a patient of mine after 4 sessions with PRP, and patients that do it, again, depending on the kind of hair loss you're dealing with, this may be something that they continue quarterly for the rest of their life. Other options, you've got linotopraz, you've got the bone marrow mesenchymal stem cells. These all work well. These are topicals, and they can be applied. You can apply it with microneedling, or they can apply it with different kinds of stamp mechanisms to get into the scalp. Wnt pathway is the bone marrow regeneration, the topical that I was just mentioning. That's how it works. Exosomes, to briefly bring it up again, we know they're extracellular vesicles. We are starting 2 studies. I think we need a lot more data to know how it works in hair, but the preliminary data is great. We do it in our office currently topically, and we are seeing good results. Again, you're dealing with the growth factors, microRNA and messenger RNA, to stimulate growth, to regenerate, and to reduce inflammation. This is actually one of my patients. I find ophiasis one of the more difficult cases to treat, and here's a patient of mine with 1 session of exosomes, and 1 year later, this is what she looks like. Exosomes again, oops, sorry, almost done. New and upcoming treatments, again, we've got the oral JAK inhibitors. As we know, it works on alopecia areata. The question is, can we use it for other forms of hair loss? We've got the cetiparant and the clicastrone that are all being studied for hair loss as well. Other things that are out there, the oils and PDO threads and tattooing, and of course, finally, there is transplant. That is an option, and I do refer out for people that do want a transplant or have tried other options, or they don't want to do anything but go straight to a surgical option. So these are all things that we discuss with our patients. This is, again, my basic approach. Patient comes in, I want to determine what the type of hair loss is. I do order lab work frequently on my patients. I sometimes do biopsies. It depends on the patient that comes in, especially if we aren't absolutely sure what they have. Trichoscans, we perform photography. I think that is one of your keys in everything you do, especially in our aesthetic realm, that you want good photography before and after so that you can actually measure. We use the hair matrix device, and you can actually compare and overlay the patients from before and after. And so we'll typically do follow-up photos at 3 to 6 months. I like to push it out to 6 if I can, but some people are very impatient, and then we will do, and it will actually count for us the terminal, vellus, and total hair counts, so you can see the change in how much improvement they've had in that time frame that you've been doing your treatments. And again, I discuss all the treatment options. You really want to make sure that they understand everything that's out there, what the cost is, how long they're going to be on it, and be honest and fair with your patients. I think that's really important. And again, I don't throw out the stress. I talk about meditation, I talk about yoga, I talk about anything you can do to reduce your stress in life. Anyone here without stress? Oh, someone raised their hand. I love it. Okay. So everyone talk to her after we're done. Okay, figure out what she's doing. And this is my information. If you need to reach me, you can always reach out. And I thank you for your time.